Hello students, my name is Dr. Kavitha, Assistant Professor, Department of Pediatric and Preventive Dentistry, Vinayaga Mission Sankaracharya Dental College, Salem. Today my topic discussion about Aesthetic Crowns and Pediatric Dentistry. Introduction. A primary objective of placing crown is to achieve an aesthetic improvement. A remarkable change is also seen in the patient's self-image after correction of the texture, shade and shape along with good physiological form and function, which helps in preventing further deterioration of the mouth by prevention of tooth migration, bone loss and arch collapse. So indications of aesthetic crowns are: first, whenever there is an interproximal caries present, excess or multi-surface caries present on the primary anterior teeth. Second one, following pulp therapy to the primary anterior teeth and the restoration of the fractured anterior teeth. Then comes incisors with hypoplastic defects, amelogenesis imperfecta, and the primary tooth which are discolored, and then the congenitally malformed primary incisors. According to Shahana S. et al., they have classified into crowns that is luted to the tooth and the crowns that is bonded to the tooth. Under the crowns luted to the tooth, there are four types. One is resin veneered stainless steel crown, facial cutout crown, polycarbonate crown and pedophiles. Under crown bonded to the tooth, strip crowns, pedojacket crown, new millennium crown, aortic glass crowns. And in case of stainless steel crowns with facing, resinous or composite crown, there are so many types. One is strip crown, composite shell crown, new millennium crown, glass ionomer crown, polycarbonate crown, pedo natural crown and pedo jacket crown. And the art glass crown also comes as a resinous or composite crown. In case of pre-veneered stainless steel crown, that is PVSSC, SSC with composite, resinous or epoxy facing crowns, there are so many crowns that comes under, that is pre-veneered. So I will list out that: new smile crown, pedo pearls, Cheng crown, white bitter crown, pedo compo crown, dura crowns. Then under this zirconia crown, which is very aesthetic than that of the stainless steel with facing and pre-veneered stainless steel crown, they are EZ crown, Zirkits crown and Kinder crown, Cerac crown, Ceramo based metal crown. So these are the only the branded names, but all comes under the zirconia crown, which is the best aesthetic crowns which is following day-to-day life. So first, this facial cutout stainless steel crown was introduced by Rocky Mountain Company in 1947 and it is popularized by Humphrey in 1950. The modification of stainless steel crowns are resin veneered stainless steel crowns and facial cutout stainless steel crowns. In case of facial cutout stainless steel crowns or open faced stainless steel crowns, it was introduced by Hartmann in 1983 and it consists of only the composite material in the facial surface of the crown. The remaining surface, that is lingual, mesial and distal surfaces are same as that of the stainless steel crown, and it prevents the unslightly silver color of the steel. And the drawbacks are still the metal margins are seen in the facial surface and fabricate procedures is time consuming. So these are the major disadvantages in case of facial cutout stainless steel crown. So this is the procedure. In the step 1, they placed the stainless steel, conventional stainless steel crown, and then they cut out the facial part of the crown and then they will etch the tooth as same as that of the conventional composite restoration, and then they bonded and the packed composite material are placed in the facial surface. So this becomes the aesthetic in the facial surface. This is the procedure in case of facial cutout stainless steel crown. Then coming to the resin veneered stainless steel crowns, it was introduced by Baker LH and Wagner WF, described as a veneered stainless steel crown facing materials like thermoplastic or composite resins. For example, Cheng crowns, Kinder crowns, New Smile, Whiter Bitter, Pedo compo crowns and Dura crowns. Aesthetic veneers are retained by the variety of mechanical and chemical bonding approaches. Some of the crown forms are bounded to the welded meshwork on the crown and others are simply chemically fused to the metal surfaces. And it is virtually no metallic structure is evident. So it is superior aesthetic than that of the facial cutout stainless steel crown. So coming to the Cheng crown, it was developed by Peter Cheng in 1987. Stainless steel crown faced with composite, mesh based with a light cured composite, and the properties are the color stability is more and the plaque is also very minimal deposition in case of Cheng crowns because of the polished surfaces. Delivered to the child in a single visit, so it is easy to use. And the main drawbacks are it's very costly because of the veneers, and during crimping it may risk of fractures there. So these are the two drawbacks in case of Cheng crowns. Coming to the classic crowns, resin veneered to the stainless steel coping. Resin is veneered to the stainless steel coping and it can be crimped, whereas a Cheng crown cannot be crimped. And in the case of classic crowns, you have to be cold sterilized, it's not to be hot sterilized. Okay. It is manufactured in US and it has superior property compared to that of the Cheng crowns. Then coming to the zirconia crown, it is very aesthetic and precision milled monolithic ceramic crown and non-crimpable like a classic crowns. Pre-crimped is also available with a retentive margin which gives the most natural emergence profile and have to be sterilized by the autoclave, that is hot sterilized. In case of classic crown, it is cost around 1265 and in case of zirconia crown, it cost around 2330. Obviously, zirconia crown is very costly than that of the classic crowns. Then coming to the Kinder crowns, it was introduced by Kinder in 1989 and have the highly characterized incisal edge. Most natural shades are present, not like bulky chiclet look of other restorations. Two type of Kinder crowns is there. One is zirconia Kinder crowns, pre-veneered Kinder crowns, and it is also less time consuming than that of the Cheng crowns. Two different lengths are present. One is regular length and the short length for the clinicians to choose based on their tooth preparations. One is Pedo 1, it is a lighter bleached shade, and Pedo 2 gives a more natural look in case of Indian primary tooth. And in case of incisal lock, bonding procedures and mechanical retention are more because there is a mesh work inside the surfaces of the crowns. It produces the incisal lock. So the bonding in case of this crown is more compared to that of the New Smile and other crowns. Then Kinder crowns become strong without the sacrificing form or function. Then coming to the New Smile crown introduced in 1991. The stainless steel crown with even more natural appearing tooth with colored coating. It is case of New Smile crown because of the hybrid composite structure, that is modified composite is called hybrid, both composite and the resin based. And New Smile crown comes in the universal style. In the anterior crowns are fabricated with both point angles slightly square. Because of the taking the square shape, it provides the best retention than compared to the Kinder crowns. Extra light or light pedo shade. Since it is lightweight and the light pedo shade, it gives the natural tooth because the milk tooth is in white in color and in lighter shade compared to that of the permanent tooth. So this is the regular length, this is the short length, that is we were discussed in Pedo 1 and Pedo 2. This is the Pedo 1 and this is Pedo 2, and it is universally contoured and this is conventional contoured. Available only in pre-veneered Kinder crowns. According to Quays et al. In 2010, access the use of anterior aesthetic stainless steel crowns among the pediatric dentists by questionnaire survey on 2600 AAPD members. New Smile crown used more among the pre-veneered stainless steel crowns. 61% New Smile, 28% Cheng crown and 35% Kinder crowns. So this shows the New Smile is very superior to that of the Cheng crown and the Kinder crown, and it provides the better marginal adaptation to the tooth and or thinner at the cervical opening compared to that of the other brands. Decreased likelihood of cement washout, reducing the possibility of cementation failure or secondary decay. So there is no less marginal leakage in case of new smile. Anatomically correct with natural tooth colored coating, which is an alternative to the traditional stainless steel and composite step crowns. So it provides best retention and the best aesthetic crowns. In case of new smile zirconia, it is also made from high grade monolithic zirconia ceramic, which offers superior aesthetic and durability compared to that of the new smile signature. So this is the new smile zirconia crown. This is new smile signature crown. This is stainless steel crown, preventive stainless steel crown. This is zirconia crown. Then coming to the white beater crowns, this is both stainless steel with polymeric coating with polyester or epoxy hybrid resin. Although the coating is very thin, it does not peel or chip easily. These crowns are no longer used now because there is the inferior aesthetic compared to that of the other crowns. Then coming to the pedo compo crowns, stainless steel with a high quality composite facing and mesh based with light cured composite crown. Like Cheng crown, they also used plaque resistant and also provides a good color stability. Coming to the pedo pearls crowns, instead of stainless steel aluminum is used. It is also coated with tooth colored epoxy paint, not a epoxy resin. Aluminum is used because it bonds more effectively to the epoxy paint, but it relatively softer and may cause the epoxy paint to wear off in areas of heavy occlusion. Although they are easy to cut out and crimp without peeling and chipping, they are quite soft and not as durable. Because of the soft in nature, this becomes a major drawbacks in case of pedo pearls. Coming to the Dura crowns, it provides a high density polyethylene veneer crown, and main advantage is higher retention compared to that of the non-veneer crowns when cement and crimping are combined. Can be crimped labially, lingually, and can be trimmed with crown scissors and festooned. It also has a full knife edge. If the facing chips or breaks after placement, aesthetic repair is very difficult because of the strength of the crown and also usually requires replacement of the crown. So this provides a main drawbacks in case of Dura crowns. That why is not commonly used. In case of composite strip crowns, it was introduced by Weber et al. In 1979. This is composite filled celluloid crown forms. First choice in case of anterior aesthetic crowns because it is very aesthetic and is also very easy to use, and it's also easy to repair if the crown chips or fractures. Most technique sensitive rely on dentin and enamel addition for retention. Need of sufficient tooth structure after caries removal to ensure sufficient surface area for bonding. So these are the Dura crowns, and in case of composite strip crown, the removal of caries can be done either before tooth preparation according to the Pingham or after the tooth preparation according to the Matthewson. This is the steps in case of placement of strip crowns. First we have to remove the caries and then we have to prepare the tooth in the case of tooth preparation burr, and we have to place a vent hole in the strip of edge of the strip of incisor tooth, and then we have to fill the tooth crown with the composite material. As a conventional composite restoration, we have to etch the tooth and then we have to bond the tooth and we have to cure it, and then we have to place the same size of the crown structure, and then we have to modify it, and then we have to place accordingly where there is a no marginal leakage present. See, there is a very superior aesthetic placement in case of zirconia crown placement. It is just a composite build-up with the celluloid forms of crowns. So for the preparation, we have to make 0.5 to 1 mm in case of interproximally, and the incisal edge of 1 to 1.5 mm, and the facial surface of 1 mm, lingual surface of 0.5 mm, and small cervical undercut should be given to provide the retention of the celluloid crowns. So there is a no marginal leakage present. So coming to the composite shell crown, it is the indirect method of placing a composite material in case of anterior tooth, requires less chair side time, no need of trimming or crimping during clinical procedure, and there is no need of post-operative adjustment of crowns since adjustments are made in lab, and there is a less technique or moisture sensitive as compared to that of the strep crown, and it also provides less post-operative sensitivity. 2-visit procedure needs lab procedures. So this is the composite shell crown. First we have to take a impression in case of putty, and we have to modify the crown according to the mesodistal width of each tooth in the primary anterior teeth, and then we have to make a composite build up in the impression material, and then we have to bond the material to the tooth surface. Coming to the new millennium crown, similar form of pedo jacket crown and strip crown, except that these crowns are made up of lab enhanced composite resin material and bonded to the tooth. The crown form is filled with resin material and bonded to the tooth, and crown forms are very brittle and can crack or fracture if forced down onto the preparation that has not been adequately reduced. The advantage is very aesthetic and also trimmed and reshaped. The disadvantage is crown is very brittle because of there is less compressive strength and needs adequate moisture control. Coming to the polycarbonate crown, this also used before commonly but not now after the step crowns and zirconia crowns come across, and then we will see about this is also very cost effective because it costs 120 per crown. Then it is an aromatic linear polyesters of carbonic acid, the crown composition, and it is heat molded acrylic resins shells that are adapted to the tooth with self cure acrylic resin and thinner and more flexible compared to that of the acrylic resin crowns, and making them easily adaptable to the prepared tooth. It is better aesthetic, easy to trim, and can be adjusted with pliers. Do not resist strong abrasive forces leading to occlusal wear, fracture or dislodgement. Not used in case of bruxism, crowding patients and overbite patients. Resilient in the mouth and allows adjustment of the crown without risk of breakage. And it is a cold cure acrylic material and placed type of relining technique is done, so the cold cure acrylic chemically bonds to the polycarbonate crowns. It is a chemical bond. It provides a better retention but inferior aesthetic compared to that of the zirconia crown. Coming to the pedo natural crown, it is ultra thin crown form that is anatomically correct, flexible, easy to fit, extremely strong, durable and automatically correctable polycarbonate crown form. Easily used in crowded situation as well as the overbite situations. In case of class 3 occlusions, unlikely stainless steel crown, the flexibility of the pedo natural crowns allows for easy application, and the chances of breakage are less if occlusion is properly checked. And the extremely strong and durable crown and superior marginal integrity is present, excellent retention with a high tensile strength, and it is not for the patient with a heavy bruxism, and greater tooth reduction is required. Coming to the zirconia crown is composed of two crowns, mainly new smile zirconia and Crinder crown zirconia. New smile zirconia provides high grade monolithic zirconia ceramic. It has increased durability with the strength more than that of the enamel. Translucency of zirconia ceramic, excellent aesthetics, and it provides with new smile try-in crown to check the fitting prior to the final cementation. In case of Kinder crown zirconia, based on nanotechnology, produces most consistent high quality zirconia, polished surface to reduce the opposing enamel wear, and it has internal retention system which locks the restoration after the cementation. Fine feathered margin makes the crown in emergence, and it is very aesthetics. This is zirconia lock ultra. See, inside there is a retention which is given lingually, and the facial in the inner surface of the crown provides the greater retention and the chemical bonding, and it is also fit passively, not actively as compared to that of the other crowns. So because of the passive fit, the retention is provided inside the crowns. It was introduced by John P. Hansen and Jeffrey P. Fisher in 2010. It cost around 2100 to 2300 per crown, and in case of Kinder crowns it cost around 1500 to 2000 rupees per crown. Coming to the Figaro crowns, it is also made up of fiberglass component. This pacemakers, flexibility is there, it can be squeezed, perfect to monitor interproximal caries, that is radiolucent in radiograph, and it is autoclavable, Pre-beveled margin, no crimping is needed, and overall reduction is only up to 1 to 1.5 mm. Since there is a radiograph is radiolucent in case of Figaro crowns, we can't able to identify the marginal fit in case of Figaro crown. That is a major drawback in this crown. So coming to the conclusion, operator preferences, aesthetic demands by parents, the child behavior and moisture and hemorrhage control are all variables which affect the decision and ultimate outcome of whatever the restoration outcome is chosen. We have to make the children with a good smile and aesthetics, and we have to restore the natural appearance of the smile. Okay, these are my references. Thank you.